Canadians are a proud people, and they take particular pride in that great national symbol, Medicare. Indeed, many Canadians will tell you that Canada has the best healthcare system in the world. This belief has been remarkably resistant to evidence because it is less a statement about facts than it is a statement about morals, beliefs, and desires. Canadians hold dearly to the notion that our single-payer system is superior to others, particularly the Americans. The intentions behind the Canadian system are the best, and therefore the system's failings are forgiven and ignored. Hi, I'm Brian Lee Crowley, Managing Director of the Macdonald-Laurier Institute, and today I'd like to begin a discussion on how Canadians could move beyond good intentions and create a healthcare system that actually produces a standard of care that we could feel proud of. This video is the first in a series that will unravel the mysteries of our system's mediocre performance and pave the way to meaningful reform.
Well, for many years, Canadians were led to believe by political people and health policy experts that we had the best healthcare system in the world, or at least among the best. And if you read the Romano report of 2002, well, he said our public healthcare system compares favorably with other public healthcare systems in the world. That was a staple of political discourse by people of all political parties. It wasn't true then, and it isn't true now.
One reason Canadians think their system is so great is because their neighbor's system is so poor. Americans spend more, they have less coverage, they have worse health outcomes, and many face financial hardships due to medical bills. Too many Canadians equate health reform with adopting a US-style system, which we can all agree we do not want. But there are many other nations in the world besides Canada and the United States, and many other universal access healthcare systems. If we could get past Canadians' affection for our system's good intentions and consider the evidence, what would we see? We're certainly among the best at spending money on healthcare. And based on current trends, spending is only going to get worse. In terms of spending, we outperform the US. But as we can see, that's not much to boast about. Compared to other industrialized nations with universal health care, Canada has one of the worst records on controlling costs. And virtually all of these other countries have older populations than Canada's. So, Jeffrey Simpson knows what he's talking about. Drop the US and look at how Canada compares globally on dollars spent on healthcare. And look again, see here how these figures are trending up year after year after year. And so, where are we heading? Right now, provinces spend almost half their revenues on healthcare. Let's fast forward 25 years and see what happens if governments don't take action. As our research has demonstrated, Canada is heading for a nasty fiscal squeeze. First, the aging of the population will lead to a slowing of national income, meaning less tax revenue. Second, key spending programs, such as healthcare, will become more costly as seniors require more medical attention. Many of Canada's most thoughtful people wrestle with this very question.
The great question at the moment is this: can we put the healthcare system on a track whereby for the next 10, 15 years, we can keep healthcare growing at 2 to 3% a year? Because if we can, that's manageable and won't be damaging other parts of the province's spending pattern for education, roads, and so on. Or are we in a 4 or 5 year period of restraint, and there'll be a lot of built-up pressure from provider groups like doctors' associations and from nurses and patient advocates and whatever. And then after 4 or 5 years of restraint, boom, we'll be back up again where we were before.
Former Saskatchewan Finance Minister Janice McKinnon lived these issues every day. And she worries that increasing healthcare costs will squeeze out other vital spending like social programs, roads, and schools.
Well, the biggest problem with healthcare in Canada is that it has been growing at a faster rate than the growth of revenue coming into governments. So if you just think of, the spending as a pie, it has been taking a bigger and bigger share of the spending pie. So in Ontario, it's over 40% of spending. In some provinces, half the money being spent is going to healthcare. Well, that's not really a healthy future, because if you think about what affects people's health, it's also the social programs you have, your poverty levels, education levels, the environment, and all of these other things are being squeezed out just to fund the system, when the other things are actually, in the long run, more important to having a healthy population.
Of course, it might be okay to be a high spender if Canada was getting top quality care in return. But we're not. Let's look at 10 comparable nations. Canada spends more than most, but gets less coverage than many others. Canada ranks below average in access to MRIs. Canada is at the bottom of the pack in electronic health records. Appropriately, in terms of access to specialists, we're at the back of the queue. Put all this together, and Canadians are paying more than they should for a mediocre system that too often doesn't deliver. We're simply not the best at this. And don't forget, among the many services basically not covered in Canada are things like most prescription drugs, dentistry, chiropractic, physiotherapy, and many mental health services. So, are Canadians right to believe that we have the best healthcare system in the world? The evidence says no. Look at Sweden, Switzerland, Britain, and many others on a variety of standard measures of health system performance. Our system is expensive and offers limited coverage. So, is this bedrock of Canadian national pride based on an illusion? Jeffrey Simpson thinks so.
Canadians wanted to believe that they had the best healthcare system in the world because they'd elevated it to their most important national symbol. So it made their chests, their hearts pump when they heard that they had the best, because they'd elevated this to this great national symbol. And who doesn't want to believe that your most important national symbol is the best in the world? And furthermore, it was either stated directly or it was assumed that not only did we have the best, but the Americans had a terrible system, and that appealed to our moral superiority vis-a-vis the United States, which is a terrible flaw in the Canadian character, but it's rather deep. So for all those reasons, we did think we had the best healthcare system in the world, and I think that perspective now lies pretty much in tatters. But for a long time, it was the defining framework for how we approached the problem.
So why are we in this mess? It's the way that we're delivering healthcare, says MLI author Janice McKinnon.
We rely far too excessively on hospitals. Part of the problem is because for Canadians, the only free healthcare is hospital and doctors, right? So if you're going to use healthcare, you're going to go to hospitals and doctors. The problem is that they are also the most expensive part of the system. And so the most expensive place to have anything done is in a hospital. And so what our goal should be is to move as much as possible out of hospitals. It doesn't have to be done in hospitals.
Funding for the system will never keep up with its current voracious appetite. After years of rapid growth, Ottawa is now promising to stabilize its share of healthcare spending. That decision has been criticized, but as we've just seen, money's not the issue. Many countries do better and spend less money, despite the fact that their populations are more costly to care for. The vast majority of Medicare is consumed by people over 65, a population that is steadily growing in Canada. The Canadian system is an expensive underperformer, and the situation will only get worse unless serious reform is undertaken. So it seems apparent that something needs to be done. We simply can't keep spending the way we have on an unreformed system. Yet governments are exceedingly reluctant to grasp the nettle of real reform. In the next episode of this video series, we'll examine the barriers, real and imagined, to making that reform a reality. Thanks for listening.